So for this video, this is the second video with indwelling catheterization. This is for a female patient. So if you haven't reviewed the male indwelling catheter portion, please do that first. I have a lot of information about things that you would want to assess, the reasons for catheterization, sizes of the catheters, and some other information there. So you want to review that first before you view this one, because this is just going to straight be the demo for female patient. So I have my order, and I know that I need to put in an indwelling catheter on our patient. She is she's being admitted. She's had a UTI in the past. She's currently having issues with urinary retention, and we confirmed that because we did a bladder scan after she tried voiding, and there's 260 mLs of urine. So we contacted our physician, got the order, and I know that with an adult I'm going to use between a 14 or a 16 French for her. I'm going to select our 14 French, which is what you have in your totes. So the plies are exactly the same as with the male. So I'm going to go in, did my hand hygiene, introduce myself. Hi, Mary Jean, it's Sam. I came back. They want us to put a catheter in since you're not able to empty your bladder fully. Have you had one before? And she says, yeah, she's had one, but I'm still going to explain that it's going to help drain your bladder, so that way decrease the risk of us getting an infection, hopefully, and it'll decrease some of the discomfort that you have. I'm going to raise your butt up. Can you tell me your name and your date of birth? And she tells me that her name is Mary Jean Johnson. She tells me her birthday. And do you have any allergies to chlorhexidine, latex, or iodine? She denies that she has allergies to those. Positioning for our female patient, get them as low as we possibly can, because if they're sitting up in the bed, it causes that pelvic tilt, makes it a little difficult to get into the space that we need to get to reach the urethral meatus. So I'm going to go ahead and put the rail down. I've got my bed at waist height because we don't want to strain our back. Once we get to our sterile principles, we don't want our tray on our bed being too far below the waist. Okay, of course we have privacy, and we're going to position her. Do you have any questions about the catheter? She says no, she's had one before. We want to be as modest as possible. We have a Chuck's pad underneath. Like I was saying with our male patients, urine can definitely come out. We're going to do perineal care on her first. Again, just like with the male, we could have our nursing assistant assist with this or do it ourselves. Okay, so we're going to provide perineal care. I need my bag. I have my trash can here, but I'm going to use this little bag at the end of the bed. We're always wiping front to back so that we're not getting any bacteria back into the urethra. So we've cleaned. We're going to help position, and for the female, we want them in a dorsal recumbent position, so we want the hips to kind of externally rotate. So heels up, hips, and have the knees fall out toward the side. So it'll be like that. Okay. I'm going to wash my hands again, and we're going to get ready for the catheterization. Now with the male, I showed how to do it on the bedside table. This time we're going to complete this in the bed with the patient. So this I am going to put roughly around the ankles. Again, I'm opening away, and I could do either side, and the last one toward me. And then I'll show a different way to drape. I could reach in and drape just like I did with the male, or I can drape kind of almost making it look like an airplane. And there's actual evidence-based practice is showing that doing this little airplane thing is actually better. So you see that if you watch the Elsevier video, but it's also shown in research that this is starting to be the preferred method. Gloves are giving me problems, but if I need to fix them, I can fix them once I have them on. Okay. All right. Move that out of the way. So for this one, I'm going to, again, I'll have the shiny side, but I'm going to fold this kind of like an airplane and gently drop it in. Now, that actually wasn't a good drape, so let's redo. I would get a new drape, new kit, whatever I need to do. We'll rewind. Okay, so I have fresh gloves and everything. So that's draped. I don't need these gloves. The fenestrated drape for the female usually gets in the way, so a lot of times we don't use it. I'm going to open my swabs. I'm going to open my lube and put that there. Don't need that. There. Going to gently remove the Foley. So that would be a contamination. I'd have to get a whole kit and start over again. So see, this sometimes happens. We'll continue. We got a new kit. We're not going to test our balloon. Okay. So I'm going to designate this as non-sterile. I'm going to spread the labia, and I have to keep the labia open the whole time. So I'm going to do the side away from me first with the swab, going the internal labia there. I'm going to do the inside, the internal labia here, closest to me, and then I'm going to go down the middle last. Okay. I have my catheter here. I'm going to dunk it in the lubricant. And for our female patient, I'm going to insert until I see urine. So I'm going to have her take a deep breath in and out and start to insert. And I am going to see urine roughly about 2 or 3 inches in, but I see urine. And then I'm going to advance another 1 to 2 centimeters. And then just like with our male patient, where I was talking about the urethral sphincter wanting to reject this foreign body that we've inserted, I'm going to bring this hand down here with my index and thumb to hold it in place. And I'm going to inflate my balloon with 10 mLs because I can do 5 to 10 with this catheter. And I'm keeping this pressed down so that I can disconnect, but I'm going to gently tug back so that that balloon's sitting in the neck of the bladder. I have this pressed down. I'm disconnecting. And then I'm going to get my stat lock or my securement device. And and secure to the thigh. And then just like we did with our male patient, we want this below the level of the bladder on a non-movable part of the bed. And we are good to go there. So for example, we talked about specimen collection. If it's freshly inserted, we can get directly from the bag. Say I come in a half an hour later and I need to get a specimen. So what I would do at that point, I can just use regular clean gloves. I would have to have the tubing kinked a little bit so that urine can back up in here, because I'm going to use this as my collection port. And once I've got ample urine, usually about 15 mLs is more than sufficient. We just clean, we insert, and pull back the amount of urine that we need. And transfer it. So that would be the process for getting it from the urine port here. For discontinuing, the same as with the male. Have some wipes available, have a Chuck's pad. Empty it before you go to remove. Regular clean gloves. Brand new empty syringe. Attach, and you'll see the fluid starts to come back on its own. You might need to assist with a gentle pull. You want to make sure that the volume of fluid you put in is what you get out. Take a deep breath in and out, gentle tug, and collect everything and put it in biohazard for whatever your facility requires. And that is it for the female.